So happy to see you too. I'm excited. Oh, come in.
Good morning, Mr. Pereira.
Dr. Halpert, this is my daughter.
Hi, Dr. Dave Halpert. Nice to meet you.
Hi, I'm Clara. I spoke to you the night of the surgery.
I remember. I'm glad you could be here today. This is Lori, our surgical PA.
Nice to meet you.
Hello.
So, Mr. Pereira, how are you feeling today?
I'm feeling pretty good. Thank you.
Excellent. Lori tells me you're anxious to get home.
Yeah, with all due respect, I feel much better, but I think I've had about enough of hospitals for a while. I hope. I can't wait to get home to my own bed and get a good night's sleep.
Well, Lori's already started working on your discharge, and we should be able to get you out of here before noon.
That's great, Doc. But one thing I don't understand. What happened to me that I got sick so fast? I know it was explained to me before, but I really don't understand what kind of surgery I had.
Well, you had a perforation in your intestines.
What is that? I heard everyone talking about that. And I know Lori told me it was like a hole in my intestine.
Well, you're right. A perforation is a hole. In your case, the perforation was from diverticulitis. And if we imagine this glove to be a piece of the intestine, pockets can form. Those pockets are called diverticuli.
I remember my GI doctor telling me about those pockets when I had my colonoscopy a couple of years ago.
Sometimes these pockets get infected, and if the infection is severe enough, they can perforate. When that happens, the intestinal content will spill out into the abdominal cavity. As you know, this can be quite painful.
That's for sure. Oh, I remember that pain. It was awful. But what did you do to the hole? You patched it or sewed it shut?
We couldn't in your situation. What we did is we did a resection. So in other words, what we did is we removed the segment of the intestine that had the perforation, and then we sutured the ends of the intestine together to create an anastomosis. Now, when most people speak of diverticulitis, they speak of diverticulitis of the colon. You had a more rare kind of diverticulitis called diverticulitis of the small intestine, which is a little bit higher up in the GI tract. So you had a resection of the small intestine rather than the colon. It can be a little bit confusing. Do you understand that?
I think so. I had the rare type of diverticulitis, but in my small intestine, not in my colon, and this diverticulitis ruptured, and you cut out the part with the hole and sewed me back up.
Correct. Now I know Lori went over your medications and you're trained in wound care. Do you have any questions?
The medicines, yes. What medicines am I taking? Do we have to learn a new pill routine?
Okay, good question. You're going to be taking all your regular home medications. The only new medication is Cipro, which is an antibiotic. You're going to take that twice a day. If you have pain, you take Percocet. Let us know if you get nausea, vomiting, diarrhea, or dizziness. These can be some of the common side effects of Cipro.
So he should continue all of his home medications and include the Cipro twice a day, as well as the Percocet every 4 hours as needed for pain. You can refer to the medication list so there is no confusion.
Thank you, Lori. This pill stuff is hard to remember.
Now let's talk about your follow-up care. You can shower today. The incision can get wet. The Steri-Strips are waterproof, so just pat them dry when you're done. Just don't submerge in a tub. We're going to give you this sheet to record the amount of drainage from your drain. It's important that you write down the amount of drainage daily and bring this with you as a record so I know whether or not I can remove the drain when I see you next week. Now, Mr. Pereira, can you please repeat your follow-up care and instructions so that I know you understand them?
Well, the drain I'm pretty good with. I emptied that with the nurse twice yesterday, and she watched me do it myself this morning, so I'm pretty good with that.
Excellent. I'm glad you practiced that.
And the instruction sheet is there to remind you of the daily wound care steps.
We have an appointment to see you next week?
Just call my office Monday and they'll schedule an appointment for you.
Everything else is written on the sheet. Just remember to follow it every day.
Can you recap what you need to do in the next few days so that I know you understand it?
I think so. He can shower today. The meds are the same. Oh, except we're adding an antibiotic and the pain medicine if he needs it. I'll call you Monday to make our appointment.
Also, that I need to empty and record the drainage output daily and bring the sheet to the appointment next week.
Mr. Pereira, is there anything that might prevent you from following through on all these steps on schedule? And is there anything else we can do to make it easier for you?
No, I'm good. I'm good. I'm good with the drain, and I know how to shower. And Clara does my meds for me, so I'm good with that. And if we forget anything, we have it on my checklist. I like checklists. They really help.
Okay, Mr. Pereira. Listen, you take care.
Thank you. I'll see you next week, Doc.
All right, sounds good. If you have any questions or problems, just call my office.
Thank you both.
No problem.
As you saw,